Biopsy. A biopsy is a medical procedure performed to obtain a sample of tissue or cells from a person's body for further examination and analysis. The sample is then examined under a microscope or subjected to various laboratory tests to help diagnose diseases or conditions. Biopsies are commonly used to investigate the presence of cancer, infections, inflammatory diseases, and other abnormalities. There are different types of biopsies, and the specific procedure used depends on the location of the tissue to be sampled and the suspected condition. Here are some common types of biopsies. Needle biopsy. This type of biopsy involves using a thin needle to extract tissue or fluid from a specific area. There are several variations of needle biopsies, including A. Fine needle aspiration, FNA. A very thin needle is used to withdraw cells or fluid from a lump or mass, often guided by imaging techniques such as ultrasound or CT scan. B. Core needle biopsy. A larger needle is used to obtain a small core of tissue, typically from organs or deep within the body. This method helps gather more substantial samples for analysis. Endoscopic biopsy. This biopsy is performed using an endoscope, a flexible tube with a light and camera at its tip. The endoscope is inserted through a natural opening or a small incision to reach the target area. Examples of endoscopic biopsies include A. Upper gastrointestinal (GI) biopsy. The endoscope is passed through the mouth and esophagus to collect samples from the stomach or upper digestive tract. B. Colonoscopy. The endoscope is guided through the rectum and colon to obtain tissue samples from the large intestine. Surgical biopsy. In some cases, a surgical procedure is necessary to extract a larger tissue sample or to access hard-to-reach areas. Surgical biopsies may involve removing an entire lesion or tumor, excisional biopsy, or only a part of it, incisional biopsy. A. Open surgical biopsy. A surgical incision is made to access the affected area and remove the tissue sample. B. Laparoscopic biopsy. Minimally invasive surgical techniques are used, employing small incisions and specialized tools, such as a laparoscope, to obtain the tissue sample. Circa robotic biopsy. Similar to laparoscopic biopsy, but performed with the assistance of robotic systems controlled by a surgeon. After the biopsy procedure, the collected tissue or cells are sent to a laboratory for analysis. Pathologists, who are medical experts specializing in studying diseases, examine the sample under a microscope and conduct various tests. They provide a detailed report on their findings, which helps in diagnosing the condition or determining further treatment options. It's important to note that biopsies are generally safe procedures, but like any medical intervention, there can be risks such as bleeding, infection, or damage to nearby structures. The specific risks associated with a biopsy depend on the location and type of procedure being performed. Your healthcare provider will explain the procedure, potential risks, and benefits to you before the biopsy. Is biopsy done only for cancer? No, biopsies are not done only for cancer. While biopsies are commonly used to diagnose cancer, they are also performed to investigate various other medical conditions and diseases. Biopsies can help determine the cause of abnormal tissue growth, inflammation, infections, autoimmune disorders, and other non-cancerous conditions. Here are some examples of conditions for which biopsies may be performed. Inflammatory diseases. Biopsies can be used to assess the extent and nature of inflammation in various organs and tissues, such as the liver, kidneys, skin, or gastrointestinal tract. This helps in diagnosing conditions like hepatitis, lupus nephritis, dermatitis, or inflammatory bowel disease. Infections. Biopsies are often done to identify the presence of infectious agents in tissues. For instance, a biopsy may be performed to diagnose tuberculosis, fungal infections, or viral hepatitis. Autoimmune disorders. Biopsies can provide valuable information to help diagnose autoimmune diseases, where the immune system mistakenly attacks the body's own tissues. Examples include biopsies of the kidney in cases of suspected lupus nephritis or biopsies of the skin to diagnose conditions like psoriasis or systemic sclerosis. Organ dysfunction. Biopsies may be used to evaluate the function and structure of organs, such as the liver, heart, lung, or kidney, in cases of unexplained organ dysfunction or to monitor the progression of certain diseases. Genetic or metabolic disorders. Biopsies may be performed to obtain tissue samples for genetic or metabolic testing. These tests can help diagnose certain inherited disorders, such as muscular dystrophy or metabolic storage diseases. Suspicious lesions or masses. Biopsies are commonly performed on suspicious lumps, growths, or lesions to determine whether they are cancerous or non-cancerous. The biopsy helps identify the specific type of cells involved and guides further treatment decisions. Biopsies are crucial for diagnosing a wide range of medical conditions and diseases, helping healthcare providers develop appropriate treatment plans for their patients. Side effects of biopsy. Biopsies are generally safe procedures, but like any medical intervention, they can have some potential side effects or risks. These can vary depending on the type of biopsy, the location of the procedure, and individual factors. Here are some possible side effects and risks associated with biopsies. Bleeding. Biopsies can sometimes cause bleeding at the site where the tissue sample was taken. Most biopsy-related bleeding is minimal and stops on its own. However, in rare cases, significant bleeding may occur, requiring medical intervention. Infection. There is a slight risk of infection at the biopsy site, especially for procedures that penetrate the skin or involve invasive techniques. It is important to keep the biopsy site clean and follow any post-procedure care instructions provided by your healthcare provider to minimize the risk of infection. Pain or discomfort. Biopsies can cause some degree of pain or discomfort, both during and after the procedure. The level of discomfort can vary depending on the type of biopsy and the individual's pain tolerance. Local anesthesia is usually administered to numb the area and minimize pain during the procedure. Bruising or hematoma. Biopsies that involve the use of needles or instruments may cause bruising or the formation of a hematoma, a collection of blood, at the biopsy site. This is usually temporary and resolves on its own. Damage to surrounding structures. In rare cases, a biopsy procedure may cause unintended damage to nearby structures, such as blood vessels, nerves, or organs. This risk is typically minimized through careful planning, imaging guidance, and the expertise of the healthcare professional performing the biopsy. Allergic reactions. Although rare, some individuals may experience allergic reactions to medications or substances used during the biopsy procedure, such as local anesthetics or contrast agents. It is essential to inform your healthcare provider about any known allergies or sensitivities beforehand. Rare complications. In extremely rare cases, complications such as severe bleeding, organ perforation, or infection spreading to other areas of the body may occur. These risks are typically minimized through appropriate patient selection, skilled healthcare providers, and adherence to safety protocols. It's important to remember that the benefits of a biopsy, such as obtaining an accurate diagnosis or guiding appropriate treatment, usually outweigh the potential risks or side effects. Your healthcare provider will discuss the specific risks associated with your biopsy procedure and address any concerns you may have.